Welcome everyone to a deep dive into a specific yet significant lung condition, amiodarone lung, also known as amiodarone-induced pulmonary toxicity. Amiodarone is a powerful medication, vital for treating irregular heart rhythms, but it carries a risk of damaging the lungs. In this video, we'll explore the causes, symptoms, diagnosis, and treatment of this condition, helping you understand the complexities of amiodarone lung and how to manage it effectively. Let's begin. So, what causes amiodarone lung? The primary culprit is, unsurprisingly, amiodarone itself. This antiarrhythmic drug accumulates in the lungs over time, triggering an inflammatory response. The exact mechanism isn't fully understood, but it is believed to involve a combination of direct toxicity of the drug and its metabolites on lung cells, along with an immune-mediated inflammatory process. Risk factors include high cumulative doses of amiodarone, longer duration of treatment, pre-existing lung disease, and potentially older age. While the risk exists for anyone taking the medication, certain individuals are more susceptible to developing this adverse reaction. Now, let's delve into the pathophysiology, or how amiodarone lung actually affects the lungs. The drug and its metabolites, such as desethylamiodarone, accumulate within the cells of the lungs, especially in the alveolar macrophages, which are immune cells residing within the alveoli, the air sacs of the lungs. This accumulation leads to cellular damage and the release of inflammatory mediators. These mediators trigger a cascade of events, including inflammation, thickening of the alveolar walls, and fibrosis, the formation of scar tissue. Over time, this fibrosis impairs the lung's ability to effectively exchange oxygen and carbon dioxide, leading to breathing difficulties and reduced lung function. Let's briefly discuss the epidemiology of amiodarone lung. It's difficult to pinpoint an exact incidence rate, as symptoms can be subtle and diagnosis can be challenging. Studies estimate that anywhere from 2 to 7% of patients taking amiodarone will develop some form of pulmonary toxicity. However, this number can vary depending on factors like dosage, duration of treatment, and patient-specific risk factors. Amiodarone lung can occur at any point during treatment, even after the medication has been discontinued, adding to the complexity of its detection and management. What are the telltale signs and symptoms of amiodarone lung? The presentation can be quite variable, making diagnosis a challenge. Common symptoms include a gradual onset of shortness of breath, often accompanied by a dry cough. Some individuals may experience chest pain, fatigue, and weight loss. In more severe cases, patients may develop acute respiratory distress, characterized by rapid breathing, severe shortness of breath, and low blood oxygen levels. It's important to remember that these symptoms can mimic other lung conditions, so a thorough evaluation is crucial. How is amiodarone lung diagnosed? The diagnostic process typically involves a combination of clinical evaluation, imaging studies, and laboratory tests. A detailed medical history, including a list of all medications, is essential. A physical exam may reveal crackling sounds in the lungs during breathing. X-rays and CT scans can show patterns of inflammation, fibrosis, or fluid accumulation in the lungs. Pulmonary function tests, such as spirometry, can assess lung capacity and airflow. In some cases, a bronchoalveolar lavage, where fluid is washed into the lungs and then collected for analysis, or even a lung biopsy, may be necessary to confirm the diagnosis and rule out other potential causes. Amiodarone lung doesn't have strict classifications, but it presents in different ways. The most common are chronic interstitial pneumonitis and organizing pneumonia. Other less common presentations include acute respiratory distress syndrome (ARDS), pulmonary nodules or masses, and rarely, diffuse alveolar hemorrhage. The cornerstone of treatment for amiodarone lung is discontinuation of the medication. Once amiodarone is stopped, symptoms may gradually improve, although this can take weeks or months. Corticosteroids, such as prednisone, are often prescribed to reduce inflammation and suppress the immune response. The dosage and duration of corticosteroid therapy will vary depending on the severity of the condition. In severe cases, supplemental oxygen may be necessary to support breathing. Rarely, mechanical ventilation may be required. Lung transplantation is a last resort option for patients with end-stage fibrosis. Prevention is key when it comes to amiodarone lung. Careful monitoring of patients on amiodarone is essential. This includes regular clinical assessments, chest X-rays, and pulmonary function tests. Using the lowest effective dose of amiodarone and limiting the duration of treatment can also help reduce the risk of toxicity. Before starting amiodarone, a baseline chest X-ray and pulmonary function tests should be performed to establish a reference point. Patient education is also crucial. Individuals taking amiodarone should be informed about the potential signs and symptoms of pulmonary toxicity and instructed to report any concerning symptoms to their healthcare provider promptly. What about the long-term outlook and recent research? The prognosis for amiodarone lung depends on the severity of the condition and the promptness of diagnosis and treatment. Early detection and discontinuation of amiodarone, coupled with appropriate treatment, can lead to significant improvement or even complete resolution of symptoms. However, in some cases, irreversible lung damage and fibrosis may occur, leading to chronic respiratory problems. Recent research focuses on identifying biomarkers that can predict the development of amiodarone lung and developing more targeted therapies to minimize lung damage. Further research is needed to better understand the underlying mechanisms of amiodarone-induced pulmonary toxicity and to develop more effective strategies for prevention and treatment. That concludes our exploration of amiodarone lung. Thank you for watching.